Hi, everyone. I'm Carrie Schaeffer, and I'm from Full Circle. I'm the Perinatal Bereavement Services Manager, and I'm going to be talking to you for a few minutes today about grief and healing after miscarriage. I'm going to share my slides with you. Here we go. So, miscarriage is defined as a pregnancy loss that happens on its own before 20 weeks gestation. A pregnancy loss that happens on its own after 20 weeks gestation is considered a stillbirth. Most miscarriages occur in the first trimester before 13 weeks gestation. It's the most common type of pregnancy loss. It's a very common occurrence that many women go through. You may have experienced a miscarriage yourself, but if not, you almost certainly know a woman who has. Studies show that between 10 and 25% of all pregnancies end in miscarriage. And the emotional response or the grief that one experiences after a miscarriage is very similar to the grief that they would experience after any other loss. Some common emotions that are experienced include shock that this has happened, of course, sadness about the loss of the baby, anger, and anger can often be turned inward. Many women feel betrayed by their bodies after this happens, and they feel angry at themselves. And likewise, they often feel guilt or shame as well, especially when they are not able to talk to someone that they can confide in and really express their emotions. Many parents feel anxiety about their next pregnancy. And of course, parents feel a yearning for the baby that they had hoped and planned for, and a yearning for that role of becoming a parent. And over here on the right side of the slide, you can kind of see many other emotions. I certainly did not list them all here, but often these emotions can feel like a tangled ball. We come in and out of these emotions. Sometimes they can feel like giant waves, and some days they feel more at bay. But the point is that they're there, and we all experience grief differently. Um, Unfortunately, many parents who go through miscarriage also experience something that we call disenfranchised grief. And this is just a fancy way of saying a grief that's not acknowledged. Um, Unfortunately, for some parents, this loss is not deemed as a real loss or as a valid loss, sometimes by family members or friends or even people in the medical community. It can be expressed through a lack of sympathy. So, some people after a miscarriage feel like no one talks about it, no one acknowledges it, no one tells them how sorry they are. It can also be insensitive behavior or comments. So things like, you can always have more babies, can be, even though it's meant to be a positive affirmation, it can feel really hurtful. And it can take away from the feelings that the griever has. It can intensify the pain of their loss to know that people don't understand what they're going through. And it can make them feel more isolated because it feels as if their grief is unwelcome. Now, we know that miscarriage has a significant impact on relationships. And in some cases, it causes relationships to become closer. But more often, there are problems that can arise in relationships following a loss like this. And some of the common problems that we see are frustration that one partner will not express their feelings about the loss, or one partner who's expressing their feelings too much. Often couples feel a disconnection when one of the members feels that the other is not grieving enough or is not grieving in a way that they feel is appropriate. Sometimes partners can feel really powerless because they're not able to, quote unquote, fix or help their partner. Sometimes people are grieving so much that they feel an inability to support their partner. They're um, so much in their own grief that they don't have anything else to give to their loved one. And then oftentimes when couples do start to think or talk about when to conceive another child, arguments can erupt because one person isn't feeling ready and the other is. So, in terms of emotional care after a miscarriage, it's really important to recognize, like I said earlier, that everyone grieves differently. There really is no right or wrong way to grieve a miscarriage. There's no prescription for the grief. So, it's important that you be respectful of and you listen to your partner rather than trying to fix things. If a partner's having a bad day, then saying something as simple as, tell me how things are going today, or tell me what's wrong, can really open up the conversation and make the other person feel heard. It's important if you have other children to talk to them about the loss when you're feeling ready to. It's important to talk about the loss in an age appropriate way. And sometimes what helps with this is using a book, such as Something Happened, a book for children and parents who have experienced pregnancy loss. Often partners need a little space from one another, and sometimes it can help to talk to another member of your family or a friend who's a really good listener. It's also really helpful to join a support group and connect with others who have had a similar loss. This really helps with the feelings of isolation and loneliness after a loss like a miscarriage. There are in-person groups, and there are groups that you can join online and participate in from the comfort of your own home. And finally, sometimes it's necessary to meet with a counselor. Talking to a mental health professional can be really helpful if you find that your grief is stuck, or if you find that your grief over the miscarriage is really bringing up grief around other losses that you've experienced. And that happens when we have multiple losses. Self-care is really important too. And I can't stress enough that, if you are going through a miscarriage, it's really important that you're just patient with yourself and that you give yourself time to heal, even if you don't feel that others around you are giving you that same grace. And if your partner needs it, then be patient with them and let them grieve in their own way, like I already talked about. Once you've met and been cleared by your doctor, then some light exercise and time outside is often really important to renewing your spirit. And so is good nutrition. Eating a well-balanced meals during the day is really important to getting you feeling like you have your energy back. And the same goes for getting adequate rest at night. And you should definitely talk to your doctor if you find that you are not getting adequate rest. Sometimes setting up some boundaries is also really healthy. If there are people in your life that are continually making your grief feel minimized, or they're continually saying or doing things that are hurtful to you, sometimes it's okay to take a break from those people and really just surround yourself with the people who are taking good care of you. And finally, practicing some really simple mindfulness techniques. Simple breathing exercises can really help, especially when you have anxiety about going back to work or about visiting the doctor's office again. Remembrance and ritual. Um, so I hear a lot from parents who've had a pregnancy loss who don't feel like they have the same um, bank of memories and remembrance items that a parent who lost an older child or someone who had a different kind of loss might have. These lives were brief but incredibly significant. And so we want to use remembrance and ritual activities to help integrate your grief into your life and help make you feel like this life, this baby, is a part of your life looking forward. So any keepsakes that you have, whether they are clothes that you bought or sonogram pictures or stuffed animals you bought for your nursery, it's really important to hold on to those for as long as you need to. Sometimes people feel like they have to get rid of these things or in order to quote unquote move on. But what we really find is that holding on to these things, keeping them with you, having them to look at and feel and smell, especially when you're really missing the pregnancy, is really important. Another important exercise is journaling about your experience. And this doesn't have to be, you know, beautiful formal writing. This can be just jotting down some thoughts every day about how you're feeling. You can journal about your experience or about the things that people have said that have upset you, or about the things that you feel grateful for. Sometimes it helps to draw some pictures to help visualize your grief or your feelings. Um, and sometimes people like to consider writing to their baby, writing a letter about the wishes and dreams you had for your baby. Um, Another good point is to consider memorializing the pregnancy. Again, this helps integrate this baby into your life and integrate your grief into your life, and also help those around you feel more comfortable helping you grieve this loss. So this can be something as simple as just something that you do with you and your partner, or you can invite some close friends and family members to help memorialize the pregnancy with you. It can be planting some trees or bushes in your yard, planting a garden that when you're outside will help you to think back fondly on the pregnancy. Some people put up birdhouses or a stone in their garden. Some people do some sort of activity like a lantern release to help memorialize that pregnancy. And it can be repeated on anniversaries that are special to you. Finally, sometimes people find it helpful to join an advocacy initiative like a 5K through an organization like the March of Dimes, or to participate in remembrance events. That these types of things can help bring some meaning to the loss. And just of note, Pregnancy and Infant Loss Remembrance Day is on October 15th. And there are celebrations on this day, or vigils to remember this day all over the country, including in Richmond. So when a couple is ready to start thinking about another pregnancy after they've experienced loss, it's really important to remember that this can be a time that is both joyful and frightening. It's totally normal to have both of those emotions, and to feel very disconnected to the pregnancy, especially in the beginning when you're waiting to know that everything is okay. It's still really important to care for yourself emotionally during this time. And one way you can do that is make sure you're working with a doctor who knows your history and who will be attentive to your needs. You may feel that you need to contact that doctor more frequently, and they should be open to talking with you about a plan for getting through this pregnancy. You can find support through those close to you, or some people seek out a mental health professional to help get them through the pregnancy, or you can find a support group at Full Circle. We have a pregnancy after loss group for parents who are thinking about or experiencing a new pregnancy. And one of the last things I wanted to do is just bring this infant and pregnancy loss Bill of Rights to your attention. This is just a list of rights that I hope will empower you to feel that you have the right to grieve this loss in any way that feels right to you. You have the right to share your story or not share your story. And you have the right to share it in the words that you choose. Um, you can reject the platitudes that people say to you, and you can ask for what you need from people. You have all of these rights, and I just think that they're really important to remember when you're going through something like this. This is a list of suggested reading. There are some books on here written for parents. And then there's a book on here, like I mentioned earlier in the slides, about talking to children about a pregnancy loss. I think we're at the end. These are some of the resources that I used when I was putting these slides together. You can reach out to me anytime. My email is Carrie, CARRIE, at fullcirclegc, like griefcenter.org. Thanks for your time, and I hope this was helpful.